I'm Sumit Mazumdar. I work as a research fellow in global health economics at the Center for Health Economics in the University of York in the UK. I work on health system financing and on political economy of health reforms in low middle income countries, including India. The main challenge in India is still, in spite of its phenomenal economic growth, India still continues to spend a lot less from her GDP on health. So it's hovers around 1.5%. So there is a demand and long standing need to significantly increase the budget for health and the spending for health. The other important challenge is the health spending in India is still dominated by private spending, which is mostly out of pocket, which is very regressive and kind of is economically leads to risks for poverty and different other welfare consequences. So it's a need that at the time when people receive health care, then you don't need to spend out of pocket. So recently, with a lot of energy and a lot of new dynamism through their new Ayushman Bharat, the PMJAY initiative, which had kind of emerging as a main policy paradigm for health financing and health service delivery in India. But even like since a lot of while it's potentially could be a game changer and kind of drive a lot of course correction for the system, but there are a lot of core areas, key areas which needs to be carefully looked into in order to make the real results. Yeah, and so for example, one area which, and I'll be trying to talk a little more today, is on financing primary care, which remains a little bit, I won't say neglected, but is actually very complex, because that's where a lot of the market for healthcare in India is very unregulated right now at the primary care level. So how do we organize it? How is it financed? There's been a lot of promise of the new health wellness centers, how that's done, and so yes. So there is a lot of new vibrancy in the policy context for health, particularly when I'm talking of primary care. But and I think here it is important that India also looks for some learning lessons from some other countries across the world which have been implementing primary care reforms, and so there might be some lessons which probably India could adopt, and already there have been a lot of some initiatives ongoing. So how do we do that might be relevant. So I think the critical need is two. First is at the primary care level, how is healthcare being provided, and a lot of countries which have done is in a more emphasis on a more community-based model. Like I'll be talking about the Brazilian example, where a lot of primary care is being done through community-based health teams, which actually reduce the demand for more costly secondary care through primary early screening and cost-effective treatment. So how does the community based model goes? Already India has, thanks to the NHM and other initiatives, India has a infrastructural setup for community-based care, but that needs to be significantly strengthened. The other issue is drugs, because as we know, like with the increasing growing incidence of non-communicable diseases, which requires continued medication for long duration of time, it's very important that affordable drugs at affordable costs are available. So there has been some discussion for some time now on use of generics and how that is being done. So the health wellness centers model proposes of an essential medicine list and establishing that kind of a supply chain of how that could be done. But it remains to be seen how the procurement and the distribution takes place. So there are examples like Tamil Nadu has some experiences of doing that. Himachal has been doing. So yeah, I mean, at a national level, depending on the state's own capacities, so how we do it is, but yes, I would like to say the manpower, how we kind of present it, and the drug distribution, depending the challenges, are two critical areas for Ayushman Bharat. Speaking on primary care is very important and needs to be discussed, planned, debated. But yeah, I think there are ways of doing that.